Okay. So we've talked about questions. Go in the chat box. Be sure and mute yourself. And I am going to record this meeting to share with others that might not have been able to come and join us tonight. So I don't think they'll see anything of you. They'll probably see me, and they'll see the PowerPoint, and then probably just the chat box if we go through the questions at the end. So that's it. I'm going to share my screen, and that way you can kind of see what we're going to talk about. Okay. So hopefully all of you can see the PowerPoint Medicare 2020. My name is Denise Dias. I work as an extension agent for the Johnson County Extension Office, which is a branch of K-State Research and Extension. We do informal education, not for credit or anything, but we cover topics around agriculture, horticulture, 4-H, food and nutrition, and ag. So we have kind of a wide variety of things that we cover. But tonight we're going to talk about Medicare. So my connection to Medicare is I am a trained SHIC, be careful how you say that now, okay, counselor. So SHIC stands for Senior Health Insurance Counseling for Kansas. It is a free program. It is offered through the Kansas Department of Aging and Disability Services, and they are the ones that train us and keep us updated every year with additional training. They also are the ones that do background checks on us to make sure that we're good people, and you know, we have to go through training every year to stay certified. I don't get any compensation for this service, and any other volunteer with the SHIC program does not get any kind of money. So, you know, if we sit down and look at drug plans, for example, we don't get any money or any compensation for helping you to find one. And then, of course, my goal tonight is to provide you with information so that you can make an informed decision on your health care. So that's what we're going to talk about. If you can't, someone said they can't hear me, try connecting with your the computer in order to hear, okay? All right, so moving along. So what is Medicare? So Medicare, as you all know, is a federal health insurance program. It's for anyone that's over the age of 65 or people that are under 65 that have disabilities or like workman's comp or something like that, where they can't work, or they're also at the end of life. So the end stage renal disease is one example. So, you know, people that don't have very long to live are able to get onto Medicare as well. Medicare has 5 different parts. You know, Part A, B, there's C, there's Part D, and then Medigap. So there's 5 different parts and pieces. And what you choose is based on what's going to work best for you and your health situation. So everybody's health is different, you know. So what works best for your neighbor or your brother or, you know, somebody you work with may not be the best solution for you. So that's why I think it's important to understand a little bit about Medicare and figure out what's really important and of use for you. So like I said, there's 4 basic parts of Medicare. Part A is the hospital insurance, and hospital is free for most of us, probably about 95% of us, it's free. People in the higher income levels may have to pay a little bit of a premium, but for most of it, it's free. Medicare Part B is medical insurance, so that's going to see your doctor. Or if you have to have some sort of outpatient procedure, that would be covered under Part B. Part C is kind of a whole nother piece of itself. I like to say it's kind of like a blending of A, B, and D. Part C works a lot like an HMO or a PPO, where you have certain doctors and hospitals and things to go to. Part C is also known as Medicare Advantage. So we tend to kind of toss that term back and forth. So Part C, Medicare Advantage, same thing, okay? The other part of Medicare is Part D. So D for drugs. That's the easiest way to remember that one. Medicare prescription drug coverage. So every fall when open enrollment happens, and it'll happen October 15th through December 7th every year, that's when people that are on Medicare look at their drug plans and make sure that the plan they're on is the least cost for them, making sure that it covers all their drugs and you know, the premium's really low, that sort of thing. So it's an interesting piece to have to work on, but it's an important one. All right. So things not covered by Medicare. Medicare is designed to cover about 80% of your medical costs, okay? So that means Part A and B is designed to pay 80% of your hospital, doctor visits, etc. Things that Medicare does not cover are eye examinations and prescription glasses. So, you know, that's one thing. Eye exams are out. Hearing aids or even the exam for them is out. Dental care is usually not included either, and especially for older adults, you know, a lot of times that's when you need dentures or, you know, things like that. That is not covered. Of course, anything else, acupuncture, cosmetic surgery, routine foot care, because as you get older, it's harder to bend over and trim toenails and things. That's not covered. And then long-term care is not covered by Medicare. There are some key dates that you need to know. So you have initially when you turn 65, there is a 7-month enrollment period, the 3 months before your birthday month and your birthday month and the 3 months afterwards. So typically people want to try and get enrolled in Medicare when they turn 65. The exception is if you're going to work beyond 65 and you already have coverage through your employer, it may not be a good time to pick that up. So you can delay that coverage, and we'll talk a little bit more about what you've got to do to make sure that you don't end up with a penalty. Part D, of course, I talked about already. When you first go into Medicare, you have that same 7-month window to get signed up for a Part D drug coverage plan. And then you can change in and out of Part D plans every year. And I highly suggest people look at it every year in order to make sure they're saving the most money. So we'll talk about that some more. There is a penalty if you don't apply for coverage when you're first eligible. So, and then Part C, Medicare Advantage, same thing, same enrollment window, that 7-month window. They do have a disenrollment period the first part of the year, so you can drop one Advantage plan and switch to another, but you may be limited in making a lot of changes with that. So it's kind of like, you know, beware before you go jumping into something different, making sure that it works well for you. So coverage begins of course, your birthday month, the month you turn 65. So let's say your birthday is in July, okay? And the 3 months before July, so you have you have April, May, June that you can sign up for your Medicare. And then if you sign up in those first 3 months, then it'll automatically start on July 1st. Doesn't matter if your birthday is July 31st, it'll still start July 1st. You can also sign up the month of your birthday, and then it would start the following month, August, for example. And then, you know, of course, the later you wait, of course, that pushes back when that coverage will begin. So you definitely want to try and sign up when the time is right. So, okay. So how do you enroll in Medicare? So enrollment is not automatic. That's one thing that's often confusing for people. You're not automatically enrolled. Sometimes, depending on if you're on disability or something, they may roll you over into Social Security, but, or excuse me, into Medicare, but that's not always the case. So in order to sign up for Medicare, you have to go to the Social Security office, or visit them online, or call them, make an appointment, whatever, in order to enroll in Part A and Part B. The fastest way to enroll in Medicare A and B right now is to do it online. It'll probably take you about 20 minutes to get through everything, okay? You could call and talk to someone on the phone, but then you know how that works. You know, you may end up being on the phone for a while. I'm not sure, the last I heard, Social Security was not allowing people into their building, so because of COVID. So, you know, I'm not even sure that you'd be able to go and visit the local office. It's possible. I don't know if they're open yet or not, but you could definitely call and check. The last I heard, people trying to set up appointments in the Lenexa Social Security office, it was taking them about 3 months in order to get an appointment to get in to see someone. So if their office is open, they have kind of like a system similar to like when you go get your tags or your driver's license, you know, you take a number and you wait till it's called, kind of thing. So I always suggest people take a good book and you know, go early and get your number and wait in line if that's what you want to do. You can sign up for Social Security in any Social Security office. So I know we have one in Lenexa, but there's also one in Douglas County in Lawrence. There's one across the state line in Missouri somewhere. So since it's a federal program, it really doesn't matter where you sign up at, as long as you get signed up through a federal office. People that are on railroad retirement benefits, they need to talk to their local railroad retirement office, because that is it's a similar program to Medicare, but it's different, and that's how you would get your benefits for Medicare if you are retired from the railroad. We talked a little bit about original Medicare A and B. Medicare providers they are able to file a claim on your behalf. It's also important when you're getting ready to you know, go on to Medicare, if you have a family doctor or a heart specialist that you just love, be sure you ask them if they will accept Medicare. So if they do accept Medicare, then you're good to go. But that's definitely a conversation you want to have with your family doctor or any specialists that you like to see, what have you. If they don't accept Medicare, then you can pay out of pocket and then submit your own claim. That is an option. So, but usually most people make sure that the doctor they have works well with Medicare. Excuse me, my allergies are acting up a bit today. Also, Medicare, like I said before, only pays 80%. So the 20% that's not covered, you'll want to figure out a way to cover it, either through a supplemental plan or a Medigap plan, or with an Advantage plan. And I'll break that down a little bit further as we go along. So this chart just talks a little bit about Part A. You know, for most people, if you do end up in the hospital, you know, Medicare pays a certain amount, and then your benefits kick in. So, you know, what's not covered by this chart, you know, you want to figure out a way to cover it. And so that's why it's important to choose either a Medigap or a Part C Advantage plan. I kind of alluded to this before, and I don't think the 2020 info is available yet. Usually it comes out about this time of year, and I haven't seen it yet. But Medicare Part B, it does currently have a deductible that you have to pay. So that looks weird. Sorry. So anyway, for most people, there's a $185 deductible that you'll pay the first part of the year, and then that's it. If you are in a higher income bracket, then you could be paying more. So for instance, if you look at the chart here, in 2019, you know, most of us make less than that $85,000 per person or $170,000 for a couple on their taxes. So then you would pay $135.50 a month for your Part B coverage. And then you can see how it goes up from there. But I just want to point that out to you, not to scare you or freak you out, but just to know that if you're in those upper levels of income, you might be paying a different premium. Part D, prescription drug coverage. Of course, you have to have credible coverage from your employer or even the VA in order to get a drug plan. In the September of every year, usually your prescription drug company will send out a statement stating that they are considered credible coverage. If you get that in September before you retire, then hang on to that. That's a great document to hang on to. If you don't take any medicines at all and you're thinking, oh, do I really need a Part D plan? What we usually recommend for people to do is to at least pick up the lowest priced Part D plan there is. This year there's one that's $13 a month. So that's pretty cheap coverage for prescription coverage. So, and they go on up from there. I think the highest one is $80 or $90 a month. It's way up there, but you want at least a little bit of coverage of some sort. If you choose not to take a Medicare prescription drug plan when you first go onto Medicare, you could end up having to pay a penalty, and you would pay that penalty for the rest of your life. So currently, let's say you decided not to sign up for, 5 years, you would take 5 times 12, and the current rate is like 33 cents for every month you didn't sign up and you could have. So you add that up and, you can end up paying, $10, $20, sometimes more than what the premium would be if you decide to, to wait to take a Part D plan. So there was a elderly woman that I talked to earlier this year that had never had drug coverage, and she was like almost 90. And so think about all those years from 65 to 90 that she didn't have a drug plan, she'd be paying a penalty on. And so, yeah, that would be ridiculous, you know, to have to pay that kind of penalty. So how do you choose a Part D plan? You do it in a couple of ways. So you want to make sure that whatever prescription drugs you currently take, you want to make sure that that plan covers the prescription. Also, you want to look at deductible. Is there a deductible? What are you going to pay during that initial cost period? Is there a coverage gap? Are you going to fall into that? We used to call the coverage gap the donut hole. I'm sure you've heard that term. Or if your prescription expenses are really, you know, huge, you could fall into what they call a catastrophic category. So, and then also convenience. How do you get your prescriptions? Do you pick them up at the pharmacy? Do you get them from the mail order? Whatever. Every year, like I said, between October 15th and December 7th, you should be checking that. Like I said, it's like a moving target trying to figure out what drug prices are going to be for the next year, and you know, making sure that you're paying the least amount that you can for those things. So to enroll in a Part D plan, you can call a SHIC counselor, such as myself. Johnson County is in the process of training about a dozen people to also become SHIC counselors and help us this fall with open enrollment. You can look on the Medicare.gov website yourself and go into the plan finder. And if you haven't been on Medicare.gov, you can go on there and you can even enroll yourself into, you know, a plan or whatever. But you do want to set up a password and ID and stuff so you can get into that system in a secure way. And then use the plan finder. It'll kind of walk you through a few screens and help you to understand what's available to you in your area, and the cost even of what those drugs will be when you go to the pharmacy. You could call the Kansas SHIC hotline. That's answered by my coworker in Sedgwick County. Her and her volunteers answer that hotline year round. You could call 1-800-MEDICARE. Not sure that you'll get a quick answer from anyone there. Typically you have to wait on the line, or you could call the drug company directly or enroll on the drug plan's website. So there's lots of ways you can enroll in a Part D plan. The next slide talks about the donut hole. So at the end of 2019, what happened was that, well, let me back up a little further. So a few years back, there was the Affordable Care Act, and part of that was that by the end of 2020, they were going to reduce the donut hole, you know, start that reduction. But with the change in administration, they started it a whole year earlier. So, so they were able to start it at the end of 2019 instead of at the end of 2020. So what does that mean for you? So that means that, you know, most people this year are paying a deductible for their drug plan. The average deductible is $435. That's the most they can charge you for a deductible. There's not many that don't have some sort of deductible. And then, of course, as you are in that initial coverage phase, you know, you will pay for your drugs at the pharmacy. And once you reach that threshold, then you would go into the out-of-pocket threshold or the donut hole. And you would stay in that area until you reach the catastrophic level. And after you hit catastrophic, then your drug costs go way down after that. So it's kind of a weird system. The donut hole, you know, it used to be you would pay 100% of the cost of the drugs. Now, with the new system in place, you end up paying 25% of the cost of the drug, and then the other 75% is absorbed by the company that's selling it somehow. So anyway, it's confusing a little bit, but it's better than it was for people, but it's definitely, you know, there's still room for improvement in my book. So Medicare Part D coverage, same thing. If you're in those higher levels of income, just want to point out that you would pay your plan premium, and depending on where you fall into those categories, you know, you would have an additional amount you would have to pay along with that. So just pointing that out so people know to expect that. Then on the other side, the flip side of this, so people that are struggling to pay for their prescription drugs and their premiums, there is a program through Medicare for people that have low income. And that low income subsidy helps them to, it can pay premiums, it can help with paying for drug costs. So, you know, it's really worthwhile for people that are either at this income level or close to it to still try for it. Even people just above that, we're recommending that they try for it. And typically the level of it goes up a little bit every year. So I'm anticipating that it will go up again for this next year. So yeah, but it's a great program, and it really does save people a lot of money on their health care. Okay, let's switch gears just a little bit. Let's talk about Medigap, okay? And then after I explain that, then we'll talk more about Advantage plans, okay? So Medigap or Medicare Supplement insurance, same thing. It's just two terms that are often thrown back and forth. People are really trying to use the word Medigap more than supplement, just so that there's a little less confusion in that term. In Kansas, Medigap plans are all regulated by the Kansas Insurance Commissioner. And they're sold by private insurance companies governed by the state and of course by federal law. So why would you want a Medigap? So Medigaps help to control or cover that 20% that Medicare does not cover. So at the end of last year, there were 10 standardized policies for Medigap. Policy, I believe it's C and F, are no longer sold as of the end of 2019. The only way people can get those kind of plans is if they were on Part A before the end of last year. So for years, we've always called the F plan the Cadillac plan because it has everything covered and you would pay your premium and that's it. So the plan that replaced the Cadillac plan, if you will, is Plan G. So the only difference between those two plans are that Plan G does have a deductible that you would pay at the beginning of the year. And this year, I believe it is $185. So all Medicare policies are sold individually. They don't do any more group or family policies. So that's kind of a bummer, but you know, that's the way it is. Typically Medigaps don't cover, you know, things like long-term care or dental or vision or any of that. Sometimes they can add, depending on the company, and that might be a question to ask when you're investigating companies. You know, do they have an additional program, or maybe they could put a rider on your a supplemental insurance policy for those kinds of things. You know, it's kind of hard to say, and each company is a little bit different, but for the most part, don't count on that happening. They just don't cover those things. I know it's in discussion now to add vision and dental into Medicare. I got a survey on it a few months ago, and I said, yeah, that would be great for people because those things do impact your health. So we'll see what happens on that. It's not there yet, but hopefully down the road, you know, they'll make a decision on that. So Medigap plans, this seems so simple, but the way you choose one is based on the premium you can afford and the rating of the company. So there's a spreadsheet that I have that I usually have printed out that I give to people, and it is a spreadsheet rating how those companies perform, and you know, are they financially sound, and do they treat their customers well, and that sort of thing. And so typically when I have class, then people can see that, look at it, and see the big list of all the companies that are offering Medigap plans in Kansas. So let's go to the next slide. So some things about Medigap. Of course, you have to have Medicare Part A and Part B in order to buy a Medigap plan. You still have to pay your monthly premium for your Part B. And the best time to buy a Medigap is when you turn age 65 or when you first go on to Medicare and the 5 months afterwards, because Medigap plans can refuse to sell you a policy if you wait beyond that initial enrollment period. Also, if you go on to an Advantage plan and then decide to change to Medigap and Original Medicare, they could charge you more because you're having health issues, okay? Also, they can turn you down, not initially, but down the road if you have a pre-existing condition. So like I put in red here, if you wait, you can be turned down and charged more, okay? So just know that, you know, initially it's easy to get a Medigap plan, but down the road, it's more difficult to get into a plan. It's not to say that you can't change or move a little bit, but if in a Medigap plan, you wanna choose one and stick with it the rest of your life, would be my advice. Also, another thing about cost of Medigap plans, it does not matter which plan you choose, okay? So let's say you choose a Medigap plan that's a Plan G, and you choose it from a company. There's a list, there's probably about 40 or 50 companies listed on my spreadsheet that sell Medigap plans in Kansas, and especially in the Kansas City area, we have tons of places to choose from, okay? No matter which Plan G you go with, that's our example, your Plan G, no matter which company you go with, they have to provide you the same coverage for your Plan G as another company would, okay? So that means, why would you want to pay, you know, $2,000 or $3,000 a year when you can maybe get the same exact coverage for $1,500? So that's definitely one area you want to look at when you're looking at Medigap plans, okay? A couple of things that happened this year, like I said, C and F went away and they were replaced by D and G. People, like if you have friends or people that have been on Medicare a while, if they're on a Plan F, sometimes it's worth it for them to do some homework and decide if they can move to a Plan G. The easiest way to do that would be to contact your provider of your Plan F and see if they'll allow you to make that move. For some people this last year, they were able to make that move and save themselves quite a bit of money. So that's why it's worth it. My next slide, this is a page out of the Medicare Supplemental Insurance Guide. I usually try and keep these available at my office. Currently, we don't have our publications available, easily accessible in our office, but you can get this information off the website, and I'll send you out the link for this tomorrow. But this chart, I think it kind of helps to explain the different types of supplements there are. And of course, they don't make it easy by any means. They confused it by naming different supplements A, B, C, D, E, F, G kind of thing. So, which doesn't correspond at all to Medicare A, B, C, and D. So, you know, confuse you even more, right? So you can see by this chart, you know, like our F plan that's starred here, that was the Cadillac. And then comparing that to G, the only difference is that Part D B deductible that you would have to pay. So I like this chart really well because it does help to kind of explain what each one covers or what percentage they'll cover, that sort of thing. Okay, so I've done a lot of talking at you right now, so I'm trying to make it a little bit more simple for you to understand. So when it comes to making your choices about Medicare, you have two options. So option one would be to take Part A, and for this example, we're going to assume that's free, so $0 there. You'll pick up Part B, which is your medical coverage for your doctor and stuff. Right now, the figure there, it's $135.50 a month, so it's $1 or $2 off. So, but it'll still help us to kind of get in the ballpark of where you're going to be. And then if you chose a Medigap or a supplement plan, they vary in price, okay? So this estimate here is $130 a month. That's probably on a little, I don't know. I've seen some for a little bit less than that. So, but it's probably more on the upper end than the lower end, let's say. And then Part D drugs. So the average plan costs about $36 a month. But like I said, there's one this year that costs $13 a month, or you can go as high as like $80 or $90 a month. So this is just kind of an average for now. And then you bundle those four things together, and your combined monthly premium is going to run about $300 a month. Okay?
Oh my God.
So one thing to note is Part B, your medical coverage, will come if you're taking your Social Security check, you know, that premium comes out of your check before you get your Social Security check. So just know, I mean, you're still paying it. You may not be seeing the dollars in your hand, so to speak, but it's still getting paid because Medicare pays that to Social Security, or Social Security pays that to Medicare. So you have that coverage. So that's how that's covered. So, okay, so that's option one. Okay, so let's look at the other option. Option two would be to go with a Medicare Advantage plan. And Medicare Advantage is kind of like going to McDonald's and getting a Happy Meal. It kind of puts everything together in a cute little package, and you still get a hamburger, fries, and a drink, right? So that's what Medicare Advantage does. It kind of puts it all together. Of course, your Part B premium is about $135 a month. And then Part C, some of the Advantage plans are free. Some of them do cost money. you know, they may have a little bit of a premium that you would pay in addition to that. So for the example here, they're estimating about 178, 180 a month for that. So, I mean, that sounds pretty enticing, right? Because you can save a little bit more than $100 a month. But there are some things to think about when you choose an Advantage plan. Advantage plans, like I said, work like an HMO or a PPO. So you want to make sure that the Medicare Advantage plan you choose and the doctor you love to go to will work together. So, you know, if you're wanting to use, like, for instance, the Olathe Health system, okay, and the doctors within that system, you want to make sure that if you choose an Advantage plan, that it will work well with Olathe Health. Some Medicare Advantage plans don't, you know, they want you to go to a certain health system, where it's, whether it's St. Luke's or, you know, the Jewish Community Hospital, you know, that kind of thing. So, you know, that's one thing to do some homework on ahead of time. Medicare Advantage plans are designed to work really well in the Kansas City area. So if you're wanting to do some traveling, let's say, you know, maybe you want to go to Florida for a couple of months every year, or you've got a kid out on the West Coast that you want to go see. Medicare Advantage plans don't travel well. So if you get out there or down to Florida and you get sick for whatever reason, you could incur out-of-pocket costs. You know, you're not going to get a discount or anything. So that could be kind of a disadvantage. Let me slide this slide to the next one, because I think it's got a lot of verbiage on here, but it kind of helps to explain things. So yeah, so if you get sick in Florida, you may be paying that out of your own pocket first before you're, and then you'd have to submit your claim to Medicare to get paid. You also have to live in a certain area, of course. So when you look at Medicare Advantage plans, and you can do that through either online through Medicare.gov, or I do have a list of Medicare Advantage plans that you can look at that are available here in Johnson County. You know, the list here is huge. If you move to Central Kansas, they only have one option for a Medicare Advantage plan, and typically there, most people don't go with it. So it doesn't work real well in that part of the state. So just know that if you're going to travel or move or anything, you may not want to take an Advantage plan. I think I've kind of talked about all that. This year, there have been some new things that have been added to Advantage plans. Okay, so that makes them really enticing for people. Of course, you can, if you have a chronic disease, you may be able to get like meal delivery to your house, especially like after you've been sick and in the hospital and you come home. It'll be like a Meals on Wheels kind of meal delivery service to you. If you need transportation, your Advantage plan can cover that to and from, like doctors, potentially gyms or places to work out, that kind of thing, and even home services. But since this is a brand new program that Advantage plan benefits are offering, they don't have any idea what that's going to cost them. So this year they, you know, didn't include that in the cost of their premiums. So when we took training last fall, they said, beware, because it could really jump up in the next year or so, because people needing to take advantage of those services. So some Advantage plans have dental and vision coverage and that sort of thing. That's kind of bundled into their plan. If you need, if you use it, typically it'll cover like an eye exam, but and it'll cover maybe a little bit of the glasses are a little bit of a discount, but for the most part, you're going to end up having to pay for the glasses. Same thing with dental coverage. You know, you can get cleanings twice a year. It may or may not cover x-rays of your teeth. But if you need a root canal or a filling or anything, that's all on you. You'll have to pay for that. So just know some of those things that you need to look for, and also make sure you study before you take an Advantage plan. So some of you, maybe I've scared you, I hope not. But for people that are wanting to work beyond 65, as long as you're covered under your employer health plan, you do not have to take Medicare. Okay, that's kind of a something that I think is very confusing to a lot of people. As long as you have coverage, you don't have to pick it up. A lot of times, many people working beyond 65 will at least pick up the Part A of Medicare, because Part A is free. And how that would work with your employer coverage would be, it would be a secondary insurance. So if you did have to go to the hospital for something, your employer coverage is going to cover it first, and then whatever's remaining, then Medicare Part A would pick up. So for some people, that is a good option. You know, just have that extra little bit of coverage, you know, as you work beyond 65. What else? So, you know, some employers do offer benefits, you know, beyond working beyond 65. So I think, you know, definitely get to know your human resources person or benefit person, and, you know, find out what that would be and how that would affect you. So the next little bit towards the bottom of this slide, if you're working beyond 65, like I said earlier, you don't have to pick up any Medicare. And in order for Medicare to not charge you a penalty, like let's say you work to age 70. So when you get ready to retire and go on Medicare at age 70, you would want your employer to fill out these two forms, CMS 40B and CMS L 564. And then that would go to Social Security, and that tells Social Security that you've been covered all these years beyond 65, and that you are not, you know, do not deserve to have a penalty for signing up later for your Medicare. So that's something to note. Most human resource people know these forms and know that they'll have to be filled out at some point in order to help you out with your Social Security. But there's always a caveat, right? So if you're working beyond 65 and you have a health savings account, there's some things to know, okay? You cannot be enrolled in Medicare and also have a health savings account that you're continuing to contribute to, okay? An HSA is what they're called. FSAs are fine, but the HSAs, they don't want you being enrolled in both. Now, if the HSA is in your spouse's name and she's, I'm assuming it's she, but let's say she's planning to work, you know, until she reaches 65 and you're retiring early, then it doesn't matter. Your spouse can contribute to the HSA as long as they're not enrolled in Medicare. The cool thing about HSAs is that it's one of the few ways that you can put away money before you retire, tax-free, and then once you're on Medicare, then you can use that HSA money to pay for like premiums or medical expenses, that sort of thing. You can't pay for your supplement with it, but you can pay for a lot of other things with that HSA money that you've set aside. The big kicker, here we are, the big thing that I'm want to point out to you is that if you are enrolled in Medicare and you also have an HSA, they will do a 6-month look back, and if they do that, then you could be charged a penalty by the IRS, and it's a 6% excise tax penalty. Because basically what they're saying is you're enrolled in 2 programs that allow you to have tax benefits at the same time. So anyway, Medicare is not going to do this, but it'll be the IRS that'll penalize you for that. So let's say you're going to work to age 70, okay, and you have an HSA. So the recommendation would be, if you're going to retire, you know, the first of the year, so then 6 months before you retire, you want to stop making any contributions into that HSA. That money will just sit there, okay, for 6 months until you get enrolled in Medicare and Medicare stuff starts for you. Then you can start using that HSA money to pay for Medicare. You can't continue to contribute to it, but you can use that money to help with your expenses. So beware of that one. That's something I just learned a couple years ago now, and it's like, wow, you know, for some people it can really hurt when you go and do your taxes and have to pay that. Of course, if you're over 65, there's lots of things you can do in the meantime to kind of bridge that gap between, you know, if you're, let's say you retire at 62 and you want to retire then, but you can't get Medicare till you're 65. You know, there may be a retiree health plan that you could pick up. COBRA, which typically is pretty expensive, that may help fill in the gaps of medical coverage, you know, between the time you retire and go on to Medicare. Federal employee health benefits. If you're a federal employee, I always like to tell people, if you have those benefits, that's like gold, because they cover really well and really do a nice job of helping you cover your expenses in, you know, beyond age 65. Or the VA. Anyone that's a veteran, definitely find out what you're entitled to and take advantage of those things. Even if you didn't retire military and only were in the military service for a few years, there still are benefits that are due to you. So find out what they are. Even some of those benefits can be transferred to your spouse too. So I know enough to be dangerous in that area, but definitely seek that information out. We do have great VA resources near us with Fort Leavenworth. And so I've been told lots of good things about people that have used that system to help with their medical needs. I know my father was a veteran, and he was able to get hearing aids free through the VA. He also got some of his prescription drugs through the VA. He was able to when he died, he was buried in a military cemetery for free. So, I mean, there's lots of advantages. So find out what they are and use them. So for most things, you can find out a lot of information online at mymedicare.gov. That's where I go to look for different things. I would highly recommend that you set up an account on mymedicare.gov so that you can go online and look at your monthly claims or see how things are being paid on your behalf. And so I think that's an important site to definitely, you know, be sure that you're logged into and are able to do that. Medicare cards, of course, this happened a couple years ago, but the new Medicare cards have letters and numbers kind of in a combination there. Some important things, not only that number, but also knowing when Part A and Part B started for you. That's another critical piece of information that you'll need to know. So if you don't have a Medicare number like this, or you know someone that doesn't have a Medicare number that's not their Social Security number, they need to get this type of card, because the Social Security card and Social Security number will no longer work on any of the Medicare websites or to apply for anything. So just know you've got to have that special card. And I'm glad they changed it, because I think that helps to reduce scams and, you know, identity issues, that sort of thing. Okay, a couple more slides and then I'm going to dive into questions. So resources, like I said, medicare.gov. You can also go to socialsecurity.gov. You know, if you've lost your Social Security card or whatever, you can apply for those things online. So it's really pretty simple. There's the Lenexa Social Security office address, and the Social Security number is like a phone bank, and they'll connect you to Lenexa through that system. Kansas Insurance Commissioner, that they have a 800 number, but their website's fabulous. They just redid it, and it's really super easy to use. And then the East Central Kansas Area Agency on Aging is the umbrella organization for the SHIC program in Johnson County. Johnson County does have their own AAA, but for this one program, it's housed under the East Central Kansas office. Okay, and then there's my contact info. You know, the best way to get a hold of me is you can call me. I don't have my email up there, but I can send you an email tomorrow and make sure that you've got that. So you can contact me if you have any questions. Okay, so there's a big list of questions. I'm going to start diving into those. Someone asked about Part D deductible. They have drug coverage from a health insurance from their employer. Is that deductible paid by the health insurance secondary insurance? So you wouldn't want to pick up a Part D drug plan until you're fully onto Medicare, okay? So it's not something that works as a secondary to what your employer is offering you. So it's either you have Medicare Part D or you have your employer coverage Part D. Should you register for Medicare even if you haven't chosen gap plan prior to 65? And will I provide this spreadsheet for all those Medigap plans? Yes, I will do that. I'll send out those links tomorrow. If you're anxious and want to find it tonight, many of the resources that are my favorite resources to use to help people figure out what to do for their Medicare are located on the Johnson County Extension web page. There's a home and family section, and under there is a Medicare tab. You click on that, there are some resources there, as well as some other little short videos if you need a refresher on some of the things that we covered tonight, because I know there's a ton of stuff that we've kind of gone over, you know. Let's see, what else is on here? Is a Medigap needed if employer health insurance is carried into retirement? Probably not. You know, if your company that you work for, employer, has some options for you, definitely when it gets time to retire, you want to weigh the cost of that versus the cost of Medicare. I've seen it happen both ways here in Johnson County, where for some people, it's worth it to stay with the retirement plan that your employer has. For others, I've seen where it's not that cost effective. So you'll want to do a little homework when you get to that point to make sure that you know, that company, Medigap, or insurance is going to help you out beyond retirement. No, you're not automatically enrolled in Medicare at age 65. Even if you're currently receiving Social Security, possibly, but with Medicare, I would not assume anything, okay? You just want to make sure that you've got all your ducks in a row and everything covered, and not rely on them to, you know, be sure and send you a card or something. If you're 6 months out from turning 65, that's usually when those cards do show up for some people. So if you're less than 6 months out from retirement, then you may want to go ahead and apply for it, okay? So yeah, don't assume anything with Medicare. Be sure you're getting everything in writing and that you're understanding everything before you jump into it. Is a Medigap needed if employer health insurance is carried into retirement? I think we just talked about that one. If you do not qualify for Social Security, how are those premiums paid? If you don't qualify for Social Security because you had a different job or whatever, then those premiums, you know, they'll send you a bill for it if they don't have Social Security to draw that from. Or if you had a federal job, it may come through there somehow. But yeah, definitely they'll charge you for it somehow. But for most people, it's deducted out of their Social Security check. Same thing, you're not automatically enrolled. So like I said, don't assume that one. Does the Medicare enroll at age 65 requirement increase to 67 like Social Security? No, currently not. So you can still enroll in Medicare at 65. Whereas like Social Security is slowly creeping up that age when you can start to claim your Social Security benefits. It's definitely worthwhile to figure out if Social Security, if you want to start drawing that right away, or if it's worth it to wait. Typically, people that wait longer get more money, of course. I am not an expert on that by any means, so you know, you definitely probably want to talk to someone at Social Security, you know, to see what your benefit will be. Or the easier way, if you're a little bit tech savvy, you could go online to socialsecurity.gov and put in your information, and you can actually see on that web page what kind of, you know, money you'll get for a check if you start drawing it now or if you wait or whatever. So that's a great tool to use. And of course, it's a safe website to get onto. So I wouldn't hesitate to do that for those of you that need to find that information out. Did I say there may be a rider possible for Medigap plans that include vision and dental? Maybe. You could ask, like when you're, you know, got it narrowed down to 2 or 3 companies that you're interested in, you could ask them if that's a possibility. If they do not offer a special rider or special policy for dental and vision, I do have a list of companies that will sell an individual dental plan or individual vision plan in Kansas. So I think there's like 8 or 10 companies for each one on that list. And I can send that to you. I think it may also be on my webpage, but if not, I'll make a note and be sure to send it all out to you tomorrow. Silver Sneakers. Oh man, Silver Sneakers is a program usually taught at the Y. And is it available in both original and Advantage plans? No. So in original Medicare, currently they don't have any allowance for a gym membership or the ability to attend a program like Silver Sneakers. But you can ask, you know, like the Olathe Community Center or the YMCA or Parks and Rec if they have any kind of discount for seniors. So a lot of times you can get the same benefit without having to be enrolled in an Advantage plan that has the Silver Sneakers benefit attached to it. So let's see. Yes, I will definitely send out resources. Why are there so many insurance company reps that sell Medigap plans? Well, a lot of those people that sell any kind of Medicare plan, supplemental plan or Advantage plan, or even a prescription drug plan, you know, if they sign you up, you don't pay them anything, but the company gives them a kickback or compensation or, you know, some sort of, you know, benefit back to them for signing you up. Okay. So, you know, the thing about that is they're in the business to sell you whatever they want to sell you. Okay. Hopefully they have your best interests at heart. You know, I've heard stories of some that really do and really do their homework and do everything they can to help seniors out and older adults out to find a good Medigap or dental, or not dental, but drug plan, that sort of thing. But then I've heard the other extreme where, you know, they don't have your best interests at heart and they're just trying to get you into a plan that they want you to get into so they can make some money. So the reason why SHIC volunteers, we're not paid. We have access to the same information and sometimes even, you know, more, depending on how things are looking down the road than they may have. So, and you don't have to pay us anything. We're not in the business of telling you what to do or making you buy something you might not want to. You know, our goal is to help you to see what your best options are and then allow you to make that choice for yourself. So, and then provide you with the information you need to make that good decision. So that's kind of why, you know, there's not a lot of us SHIC volunteers around in Johnson County, but definitely, I think, you know, I'm kind of biased, I guess, because I think we provide a great service free of charge and are not out to like get you or anything like that. So great question. Yeah, so we're kind of at that point. I know we're kind of getting to the end here. I will stay on a little bit longer if there's anyone else that has a question. Otherwise, be sure to expect an email from me tomorrow. I'll send out a survey. A lot of times people like the slides that I use just so they have something to refer back to. We'll also have the video link. I'll share that with you if you need to review it again. And then I'll send you the Johnson County, the like exact page on our website that has my favorite resources. So I'll get that all out to you tomorrow. And then that way, if you have questions, call me, you know, or email me. I tend to answer email faster than a phone call. So I'll be honest with you there. But I answer questions, you know, year round regarding Medicare and just want to help you to make the best choice that's right for you. So with that, I will let you guys, you can send me another chat. You can unmute and ask your question. I'm happy to do whatever I can to help you guys out. Sorry about that. So, or maybe you're ready for dinner. I'm not sure. thank you all for coming.
Thank you, Denise.
You're welcome.
I'm in shock.
You're in shock. There's a lot to know and a lot to consider. So,
Can we just take Obamacare instead?
no, actually you can't. You can take Obamacare up until you're 65, but then you have to go on to Medicare. So, and depending on your income, for some people, Obamacare is a great deal. For others, it's not so good. So, yeah. Great question, though.
It's a lot better for me.
For now, but once you turn 65, then you'll be pushed into Medicare. So, whether you like it or not.
I get that.
Yeah.
Thank you.
You're welcome. Take care.
You too.
Yep. And yeah, there will be a recording of this, and I'll be sure and send that link out to you tomorrow when I get that. So
That's
anyway,
awesome.
yeah. Thank you all so much. So I hope this was helpful.
Very helpful.